In this video, I will tell you about diabetes mellitus and its complication in older patients. There are many ways to diagnose blood sugar, but here we will discuss just physical examination of diabetes, because physical examination is the only way to examine the exact severity of disease. There are 5 basic hand diseases caused by diabetes. The first is Cheiroarthropathy, the second is Dupuytren's disease, the third is carpal tunnel syndrome, the fourth is Flexor tenosynovitus, and the fifth is muscle wasting. Diabetes is a deadly disease. If it is not treated properly, its effects can begin to show on the hands, which is called Cheiroarthropathy. In Cheiroarthropathy, the movement of the joints of the hands is limited, that is, the joints of the hands feel stiff while moving. Like other diseases of the hands, Cheiroarthropathy also begins to manifest itself at a certain age in patients affected by diabetes. Its specialty is that when stiffness is felt in the joints of the hands during movement, then pain is not felt during that time. Palm and finger joints, the joints between the fingers are more affected by it, and sometimes it also affects the ankle and shoulder joints. Stiffness between the joints starts from the little finger and spreads to the thumb. Cheiroarthropathy is found in 30% of diabetic patients.
Diabetes is a deadly disease. If it is not treated properly, its effects start to show on the hands like Dupuytren-like symptoms. When Dupuytren occurs, one or more fingers of the hands begin to curve towards the palm, due to which patients find it difficult to straighten their fingers. Know one thing well: before the fingers become crooked, the wrists begin to form. Neglecting the wrists of the hands leads to crookedness of the fingers. When the blisters start to form, there is no pain. But when they are growing, then there is a feeling of constant pain and itching. It mostly affects the ring finger or the middle finger. And when the fingers become crooked in patients due to this, then the palm and finger joints are affected like a sack. Dupuytren is often prominent in diabetic patients, and 30% of patients are those who are over 50 years of age or whose blood sugar level is more than 200 milligrams. This disease is caused by the inflammation of the median nerve between the bones in the wrist. To understand carpal tunnel syndrome, you must first know about carpal bones and carpal tunnel. The bones in the wrist that help the movement of the wrist are called carpal bones. There is a space between the carpal bones from where the veins and nerves pass, which is called the tunnel, and the space between the carpal bones is called the carpal tunnel. If you have numbness in your hands, the median nerve plays an important role in controlling arm and hand movements through the brain and spinal cord. The median nerve passes through the tunnel through the wrist to enter into the palm, from where it joins the thumb, to the index finger, and also to the middle finger.
Generally, trigger finger is the condition in which the fingers hurt due to inflammation in the tendon. Your fingers have pulleys that become tight due to inflammation, and a tendon runs through the middle of the pulley, which cannot move due to the inflammation of the pulley. Due to continuous movement during inflammation in the pulley, inflammation also occurs in the tendon. Due to inflammation in the tendon, the finger joints become sensitive and hence pain is felt during movement.
Let's see what is muscle wasting according to its definition. If IR occurred due to any disease, your muscles become weak, shrink or end completely. Such a condition is called muscle wasting or muscle atrophy. This disease occurs mostly in diabetic patients. Due to this disease, your body may lose strength or you may be unable to move.